Hello, everybody. If you're here for the Coping Through COVID-19 Self-Care webinar with today's topic being sadness versus depression, then you are in the right place. So welcome to our new folks who are here and welcome to our repeaters. So we're glad to see you again. This is our last webinar in our series, so thank you for joining us right at the end here. We know that typically towards the end of the semester, feelings of sadness and depression can come about more, especially how this past year has been with the pandemic and COVID-19. So we'll dive into that a little bit more. Before I do, let me introduce myself. Hi, I'm Sarah Moscow. I use she, her pronouns, and I'm the Health Education Coordinator for Student Wellness, which is at Counseling and Consultation Services. And I'm joined by...
Hi, everybody. I'm Andrea Drott. I'm the Associate Director for Student Wellness at Counseling and Consultation Services. I use they, them, or she, her pronouns. And we're excited to chat with you guys today.
Thanks, Andrea. And for those who are joining us, just letting you know this presentation is being recorded. So what specifically are we going to be talking about? So we're going to briefly touch upon mental health. What is it? Mental illness and how it's been impacted during COVID-19 and just this year. We'll then dive into the main portion of this topic, which is talking about what's the difference between sadness and depression and why is it important to know the difference. We'll then wrap this up with a variety of ways that you can help yourself, you can help support a friend, and what resources can be beneficial to you if you're experiencing these experiences. And as a disclaimer, we want you to know that some of the topics that we're going to be talking about today can be distressing for some folks. So we want you to know that if you need to step away or leave the presentation, that's no problem. If you need somebody further to talk to and support you, know that your friends at Counseling Consultation Services they're here to support you. So you could call them or visit their website anytime for more information. I also have their phone number and their website up on the screen as well. So again, we may be talking about some distressing content, and we're here to support you if you do experience a reaction with that. With all of that and introductions out of the way, I'm going to give it to Andrea to talk about mental health.
So we're going to talk a little bit about what mental health is and why it's important. And we're going to start with the WHO definition. So mental health is the stuff that is a state of well-being where one recognizes their abilities, can cope with normal stressors of life, can work productively, and is able to make contribution to one's community. So when we're thinking about mental health, it's this overall state where we can do the stuff we intend to do and want to do and support the world around us. So why is mental health important? So it's one of the essential parts of your overall well-being. So when we look at our well-being wheel, we have our 7 dimensions, and mental health actually is supported in many areas, not just one. So our emotional well-being, our social well-being, our physical well-being all impact our mental health and health overall. And by supporting all of these areas through our mental well-being, we can cope with daily stressors, support our physical health, and our physical health supports our mental health. So that cycle is really important. We nurture our relationships, connect and contribute to our communities, working productively, finding stability and harmony, realizing your full potential, reaching your goals. So all the things that you came to college to do, part of what helps and supports you getting there is your mental health. So as we think about what mental illness is, similar to physical illness, it's a condition that impacts your mental health. It's changes in thoughts, feelings, and behaviors, things that might impede your areas of functioning. So it may impact your relationships, it may impact your ability to complete work or school. even enjoyment in everyday activities can be impacted by mental illness. And so when we're thinking about mental health concerns, lots of folks across the US, this is 20% of the population is experiencing or will experience at some point a mental illness. And they are manageable with help. So figuring out how to manage mental illness can be really impactful in creating and continuing to support your well-being overall. So, as we consider mental health, mental well-being in the context of COVID, there's been a lot going on, right? And a lot that has impacted our abilities to cope and our ability to stay mentally well. Um, And overall, folks during the pandemic have expressed increased depression and sadness. These are really common as impacted by COVID. Active Minds is a student organization, a national student organization that did a study on the pandemic's impact on student mental health. And those surveys indicated that because of the pandemic, 78% of students were dealing with some form of disappointment and additional sadness. They also, 77.4% also reported feeling lonely and isolated. In addition, more folks are experiencing sadness and depression as reported uh, in that survey. So 73.23% were experiencing more sadness because of the pandemic, and 60% were experiencing more depression because of the pandemic. This is part of the reason we really wanted to make sure we help students understand how are these things related, how are they different, and what is the impact of COVID overall? But in general, how do you then support your mental health and well-being? COVID's been a pain for everybody. And I think we are all impacted in some way. And so by experiencing this is not uncommon as part of the COVID experience. So I'm going to turn it over to Sarah to talk a little bit more about those experiences and how that might be expressing for you.
Thanks, Andrea. And that's really one of the reasons why it's important to know what's the difference between feeling sad, feeling disappointment, experiencing grief, and experiencing depression. Because once you're able to be aware of what you experience, you're then better able to get the support that you need to feel better. Like Andrea was saying, this pandemic has sucked. It really has. Everybody has experienced some form of sadness, disappointment, and grief throughout the pandemic, and we want to feel better about it. So let's start with identifying what each of these experiences are and what they look like. So the first one is sadness. So sadness, it's a basic human emotion to feel sad. So it's an emotional state of unhappiness due to the loss of something valued. So the loss of something valued is going to be different for everybody. So you may feel sad, or I may feel sad that Baskin Robbins is out of my mint chocolate chip ice cream, which they tend to do at 8 o'clock at night when I really want it. And that makes me sad because I value mint chocolate chip ice cream from Baskin Robbins. But some of you are like, I don't value that. Why would you get sad about that? Because I value it. It depends on your experience and what makes you sad based on what you value. Now I've added disappointment in here because disappointment, you could say, is like a type of sadness. It's sadness from a loss of expectations. So many of us have experienced disappointment this past year. Our college experience has been totally like at a loss of expectations. I know when I think of going to college, I think of I'm going to have all my friends. I'm going to be able to do this and do all these activities and really connect with people. And the pandemic has made us not able to have that expectation. So that is what disappointment is, a loss of expectation. So what is grief? Grief is a normal internal experience after a significant loss. So sadness and grief are both normal human emotions and experiences. So if you are feeling sad, if you are grieving, you are not broken, nothing is wrong with you, you are just human and you're experiencing what life is. And so grief is very complex, which is why I didn't say it's an emotion. Grief impacts you both physically, emotionally, and your thoughts. So it's not just an emotion, it's an entire experience. I've also noticed that it's time varying, meaning there's no time limit on grief. You can grieve for a week, a month, years. It depends on who you are, your experience, and how you feel that grief. And everybody grieves in their own way. So there's no right way to grieve. People talk about the 5 stages of grief. They're true in some sense, but everybody goes through them differently, backwards, forwards, skips a step. It depends on who you are. Now, depression, on the other hand, is severe feelings of sadness that impede your functioning and are present for more than 2 weeks. I'll get to that last part later, but you'll see when you compare sadness, grief, and depression, the feelings of sadness increase. So you have sadness, grief, and then depression. You'll also notice that between grief and depression, they both impact you physically, cognitively, and behaviorally. So then really, what is the difference of the two? Let's go ahead and take a look. So in the left-hand column, I have a symptom that they both share. And then in the middle column, I elaborate on what it looks like when you're grieving. And the last column is what it looks like when you experience depression. So the main feature of grief is feelings of sadness and loss, whereas depression, it's a persistent sadness and an overall loss of the things that you used to enjoy or seek pleasure from. Now, the thing with the sadness between the two of them is that when it comes to grief, the sadness comes in waves. People often describe grief as like the ocean. The ocean can be filled with storms and huge waves. It could just be choppy someday, or other times the ocean's rather peaceful and almost relaxing. And grief can be that way. Grief can be enjoyable, or it could be really hard. Whereas depression, that sadness is persistent every day for a very long period of time. The thoughts associated with the two of them, grief, it's really explicitly what that specific loss was, or the death of an individual, or a pet, or so forth. Whereas depression, the thoughts are more, lack of a better phrase, you're being very mean to yourself, very critical, these negative ruminations. Ruminations meaning you're just thinking on and on and on and on about one thing. For positive emotions like joy, happiness, humor, when you're grieving, you're really able to experience those emotions. Whereas depression, it's quite difficult to feel that sense of I'm content or joyous or humorous. Other things to note, in grief, your self-esteem really isn't affected, whereas with depression, it's pretty affected. You have feelings of worthlessness, you just really hate yourself, and it's really, really hard to experience depression. Lastly, suicidal thoughts can be present in a both grieving individual and somebody who is struggling with depression. With grief, those thoughts are really based on the deceased, if it's with the death of a loved one, and possibly joining the deceased. Whereas depression, the suicidal thoughts often come from this feelings of worthlessness and really not feeling like you can manage the pain of depression. So that's kind of an overall difference between the two. The main takeaways I want you to know from what everything I just identified is that one, sadness and grief, normal experiences. Everybody experiences them. The second is that we really want you to be mindful of when sadness and grief becomes a persistent and overwhelming experience. And if you find yourself having troubles managing those feelings of sadness or grief, we really encourage you to seek support, because you may start getting in the area of a depression disorder, depressive disorder. So what does it look like when sadness does kind of get into that clinically significant, I may have a depressive disorder? So first, what are depressive disorders, or disorders that have depression in them? These are a group of disorders characterized predominantly by sadness, which impedes functioning. So you could be sad for a couple of days, totally normal. Any ladies out there who have their menstrual cycles, it's totally common to be sad like that whole week. But that is something that's common, it's not consistent. Whereas a sadness occurs over a long period of time, you're having trouble going to class, trouble doing that, this may be in the realm of depressive disorders. Now, we're not going to go through all of these today. We're predominantly going to focus on major depressive disorder, which I'll get to in a second. But these are some other common ones. And I really want to emphasize that last bullet point, which says depressive disorder due to another medical condition. It's very common for a medical condition or something biologically within your body to cause depression. So common. So premenstrual dysphoric disorder, seasonal affective disorder can be aligned with that, or even major depressive disorder. All of these can be triggered by something biologically. So something to keep in mind. Lastly, bipolar disorder is often a disorder that's really talked about around depression. Essentially, bipolar disorder is an illness where you have episodes of manic and episodes of depression. Manic can best be described as these really high levels of energy, and depression is these very low lows. So bipolar disorder, you often hear people describe it as mood swings, but it's really way more than that. It's biological. So there are some neurotransmitters in the brain that are kind of causing that experience. And these episodes of manic and depression occur over a long period of time. So it's not just a mood swing where you're like sad and then you're like really happy. It's long periods of time that impede your ability to function. So some key things to note about these disorders, we really encourage you while we're talking about this, don't diagnose yourself, talk to a professional. We're really doing this to increase your awareness. These disorders that we're discussing, they all are long lasting and impedes your functioning. I know I've repeated that multiple times, but that's just so you don't diagnose yourself. Most importantly, as I mentioned, some of these depressive disorders can be brought on from a biological reason. So if you are starting to experience the symptoms I'm about to share, maybe going to a medical doctor, physician first to check to make sure everything is okay, can then help you to identify what's the best route of support for you. Is it more biological or mental health, which they'll probably talk to each other, but it's a good place to start. So what is MDD, as some people abbreviate it, or major depressive disorder? Essentially, it's depressed mood or loss of interest that indicates a change from previous functioning. So some people, their personality is just generally, kind of flat or down. That's okay, that's their personality. But maybe they experience it significantly more and it's a change from how they usually are. Also, this feeling of depressed mood or loss of interest is accompanied by 5 or more symptoms I'm about to share with you and occurs during a 2-week period. So this is what mental health professionals look for when they talk to someone about depression, is what symptoms and how long have you been experiencing them? So depression impacts you physically, cognitively, and behaviorally. Some of the physical signs could be you're sleeping a lot more, you're sleeping a lot less, you have troubles falling asleep, you have no problem falling asleep. Your change in how you usually sleep, essentially. Your appetite changes, eating more, eating less, so forth. And your energy is overall decreased. Some people describe depression as when they try to get up in the morning, it's like there's just this weight on them that makes it a lot more difficult to get up and just move around. There's a lot of things emotionally that someone can experience. That persistent sadness we identified, loss of interest, all these negative thoughts about oneself, feeling overwhelmed, and irritability can also be something predominant in depression. Lastly, when it comes to thinking, it can be more difficult to concentrate, make a decision. You're really looking at life with like a half glass full type of thing, or half glass empty, excuse me. So that pessimistic view. And suicidal thoughts can be present. It's not always a symptom, but it certainly can be in depression. Main things I want you to remember, please don't diagnose yourself. We really want you to go talk to a professional, a mental health professional, if you're noticing any of these symptoms within yourself, if it's becoming overwhelming. We wanted to share this information so you can be more aware of what you experience, and so then we could validate what you're experiencing. Hey, that persistent sadness you're experiencing, that's depression, and we encourage you to get support to help your overall well-being. And please be kind to yourself. It's so easy to be like, oh man, I'm sad, I have depression, like this sucks, I'm dumb. It's so easy to fall into that. So we encourage you, be kind to yourself. This year has been tough. It's okay to experience that sadness and disappointment you may be having. And with that, I'm going to have Andrea talk to you all about how you could support yourself and how you could support a friend this time.
Thanks, Sarah. So I also just wanted to briefly mention part of the reason we wanted to talk about sadness, grief, and depression all together is because you may be experiencing each of those separately throughout this pandemic. And grief, again, comes in waves. And just because it doesn't fall under depressive disorder doesn't mean that you can't get support for that too. And so as we're thinking, even if it's just levels of sadness that you're not used to or aren't comfortable with, it's okay to talk to someone and get support for that too. So anytime that you're uncomfortable with how you're feeling, that might be the time to do something else. So when we think about seeking support, next slide. We want to make sure that we have a conversation. So if you are finding a friend who's maybe had a lot of loss this semester, this year, or has been down or avoiding going out or doing the things that they normally would, and it's not just pandemic related, make sure that you listen with an empathetic ear, put yourself in their shoes, try to understand, not just respond, oh, I think you're experiencing depression, you should go see a counselor. That may not be the most helpful way to approach the situation. So start by listening and understanding where they're coming from. Don't lecture, obviously, telling somebody what to do. You should, you need to, you must. That usually puts up barriers. People dig their heels in and do other things than what you ask. So when you think specifically about how to have this conversation with a friend, you have so this is that we put an example in here. You have the most wonderful sense of humor and personality, but when you're depressed, you avoid being around your friends. Pretty typical of depression, right? And so I miss you. I want you to feel well and be well and to experience the world in a more positive way. So having that conversation, being specific about the behaviors that you don't like versus the person that you do. Um, talk about how those actions don't align with their values. So if they're in a situation, I know you really love being with your friends and you've been avoiding our Zoom calls all pandemic long. What can we do? How can I help? And speak from your experiences. Talk about the things that you've seen, that you've experienced. Don't necessarily talk about the gossip or the other things that you may have heard that, again, probably will put up red flags and barriers for somebody actually seeking help. So more so as you're helping a friend, it's also about not taking on too much of your own on your own. So you can't control anyone but yourself. And the desire to change has to come from within the person making that change. So you can give them information, you can encourage them, but they have to make that choice for themselves. And you can't control anybody but you. So providing the support that you can, also acknowledging the things that you can't take on. So you can't, I mean, maybe you can physically sign on to the counseling session with somebody, but that might be a boundary not to violate. But overall, recognize where the things that you can help and the things that you can't. Also knowing offering to go with them, offering to help them set up an appointment, letting them know that you're there to listen. Um, I had this conversation with a colleague just a couple days ago, that sometimes people just want to hear that sucks. They don't want to hear more than that. They don't need solutions. Sometimes just being with them and hearing, yeah, you're right, that sucks, is exactly what they need. So by being present, being available to listen, can be really helpful. Also encouraging them to consult a professional. If you're seeing some of those symptoms in a friend, it's important to get them connected to the right resources. We also have students of concern form. It is a confidential form for if you aren't willing to have the conversation directly, or maybe have seen this in someone that you're not super close to and don't know them very well, but know their name or their experience, you can share that in a confidential form. Staff will then reach out and reply to make sure that students are safe. And if a friend expresses suicidal thoughts, call 911. It is an emergency. Someone expressing suicidal ideation or thinking about suicide needs and deserves help. And providing that help is really important. We'll talk a little bit more about suicide in a few minutes too. Oh, now, is this me or you? Me. Excellent. So when we think about the warning signs, if somebody is expressing suicidal thoughts, they're talking about wanting to die or killing themselves. I just don't want to be here anymore. I can't keep doing this. I can't keep going. Phrases like that, things like that. Ask the question. Um, if they're looking for ways to kill themselves, online or in person, Googling how to painlessly die, things like that. That's a really, really big red flag. Um, that general overall feeling of hopelessness or having no purpose, feelings of worthlessness, not being worthy to be alive, is a big indication that somebody might be thinking about suicide. Drug and alcohol abuse are often precursors to actual suicide attempts, as well as those suicidal ideation and thoughts. Um, Sleeping too little or too much like some of these are just signs of the depression that then are maybe have these underlying suicidal thoughts attached. And so as if we're seeing some of these other things like the acting anxious, agitated, reckless, showing rage, talking about seeking revenge, things like that, and that sleeping too much, too little, it may not be expressions directly of suicide, but these may be overarching experiences that are definitely related to suicide underneath. So look for some of those signs to know that it's important to get to the next step to get them help. So, as I mentioned, when you hear somebody say, "Oh, I just don't want to keep going," are you thinking about suicide? Are you thinking about hurting yourself? Do you have a plan? Finding out if they have a plan can be a really big one. Yeah, I'm going to do this. I'm going to do that. I'm going to do this. Then definitely be seeking help. Nobody's asking you to address this on your own with a friend. Call the helplines, call 911, get help for you and for your friend. Have you thought about when? Oh, sorry. Nope. I was just gonna, so thinking about when or how, so it's not just about the what they're going to do to hurt themselves, but the whens can be really helpful to know if they're still like maybe in the next 6 months. Well, that may not be as imminent, but it's still important to not assess it for yourself. Um, and then are you seeing a doctor or mental health professional? So if you don't know if they're already in counseling or have mental health support, that can be a really good place to start to encourage them to call that counselor to help them get connected to resources that they already are connected to. And so by being intentional about asking that question can help you know who and where their next step might be. So do let the person talk and listen to them without judging. So we have a list of do's. So the things that you should be doing if somebody is expressing suicide, let the person talk, listen to them without judgment. Don't put your own stuff on them. Just acknowledge you're here to listen. Reassure them that treatment and help is available. Tell them what they are experiencing is treatable and suicide feelings are temporary. Suicide is a very permanent solution to a temporary feeling. And by helping someone in this process, it can be really helpful to acknowledge that piece. We have a list of don'ts. So don't try to minimize the problems or shame the person into changing their mind. So whatever they're experiencing, it may not seem like a super big deal to you, but it is a big deal to them. And their mental health, maybe a mental illness is telling them that this is really significant and they can't get past that. It doesn't matter what you think about it. Don't try to convince a person who is suicidal that it's not that bad. Again, what is not that bad to you, to them, they can't see that. Don't preach about suicide being right or wrong. That again is not probably a thing that is entering into their decision making process. It it's too abstract for them in that moment to connect to often. So we got our do's, we got our don'ts. There's a lot we can do to help.
Thanks, Andrea. And with that, with suicidal thoughts, the thought may cross your mind, well, why are you thinking about this? Can't you just stop these thoughts? And when it comes to depression, it really is just a part of that illness that can't always be controlled. And so that's why it's so important to seek mental health support. So we share with you these signs so that you can help your friends, you can help yourself, and direct them to the supports that they need. If you're questioning, I think they're suicidal, call 911. I think they are, get them to somebody who's helpful, because then that professional will be able to determine, yes, they are, no, they're not. How can we help them is the main thing. So who can help you on campus? There are 4 counseling centers on campus. You all may know of counseling and consultation services at the Campus Life Building. Those are free services to students.
They
There are
also,
free,
their
oh,
phone number works 24 hours a day, 7 days a
thank
week.
you.
So if somebody is experiencing suicidal thoughts and you're not comfortable calling 911 for any reason, you can utilize our main number and they will triage you, they will get you connected.
Thanks, Andrea. If you could put that number in at the end of the presentation or whatever, that would be great.
Yep.
So Counseling Consultation Services is here for you 24/7. There are 3 other centers on campus. They are training centers, so they're students who are being trained to be mental health professionals, provide counseling or psych services. And the Counseling Consultation Training Center is free, and the other 2 are sliding scales, meaning what you pay for their services depends on where you're at and what you could provide. And Andrea has put counseling consultations number in the chat. Again, that's 24/7 that you could contact them. Other mental health resources for you. We have us, that's Andrea and I and our team, which is student wellness, and we can provide you a lot of educational materials on mental health and well-being and physical health, nutrition, sexual health, you name it. We can help you out with that. If you're looking for a provider, a mental health provider that isn't on campus, maybe you don't even live on campus, where can you start? I always recommend Psychology Today, so you could Google that, and you could put in your zip code. You could find a provider based on where you live, how much you want to spend, your insurance. Maybe there's something specifically you want to talk about. So I'd really recommend that. Others that I have on the screen for you are phone numbers that are super, super helpful if you're in a crisis situation. So there's the National Suicide Prevention Line. There's the crisis text line with NAMI. So if you prefer to text for support, which is totally okay, you can text NAMI. And also for our LGBTQ plus folks out there, there's the Trevor Project. They're super awesome. If you prefer to reach out to them, that number is there, and you could text them too. So I'm going to go ahead and put all these resources in the chat for you. That includes all their websites and that kind of thing. Lastly, we recognize that when you go in for mental health support, sometimes it takes a while to get that first appointment. And if you're experiencing high levels of mental health concerns, that could be really distressing. So what can you do in the meantime, especially with sadness, grief, and depression? First, when you're sad, when you're depressed, your depressed mindset tells you that everything is impossible. You can't get out of bed. You can't go hang out with your friends. It's not going to be worth it. What's the point? You're dumb. All these things. While this is going to sound really hard if you're experiencing this, I want you to do what your depression is telling you is impossible. That's one of the key things to working through depression, is doing what it convinces you that you can't, to use that resilience and just go forth and do it. So what are some of those things? Connect with others. Depression and sadness and grieving is all very isolating, because that's what it's telling you to do, when connecting with others or a support person can be so, so helpful to just talk to, just to be around. Be kind to yourself. The sadness that you feel tends to really beat yourself up. Try to really think about how awesome you are, honestly. What would a dog say to you? I always say dogs, because dogs are always like, oh my God, you're amazing. You're the best person ever. Like, what would a dog say how awesome you are? Eat, sleep, and move. It's so important to take care of yourself physically, especially since how we talked about how sadness, depression, and grief can impact you all physically. So if you're feeling sad, ask yourself, have I eaten well today? Have I eaten a balanced meal? When was the last time I ate? Did I drink enough water today? If you haven't done those, go do them. Did I move at all today? No? Go outside, just walk for 5 minutes. Just get up from the couch, walk to the kitchen, and come back. I know sometimes when I'm feeling down, I'll tell myself, okay, while dinner is being made, I'm not going to sit down until dinner is made. So setting those limits for yourself. Identify rumination triggers, meaning if you're able to identify what starts that like really negative spiral in your head, that could be really helpful, so you could catch it before it really starts. So maybe it's you failed an exam, and that gets you in your, oh my God, you're so dumb. How could you do this? You failed. If you notice that that's the thing that triggers it, you could then do things to help yourself. Okay, I failed. I know I'm going to start thinking bad about myself. I'm going to go call my best friend. I'm going to go to that really nice spot on campus and walk there. Do things to support yourself. Lastly, be mindful, express yourself in a creative manner, and take time off if you can. We know it's not always easy, but maybe you're experiencing these symptoms because you need some time for yourself. That is what we have for you today. And Andrea, if you want to wrap us up then, I'm going to put the survey in the chat.
Again, our big takeaways for today are, first and foremost, don't diagnose yourself, not your job. If you are experiencing any of these things, it's okay to seek support and to start looking for places and people to talk to. If you find yourself in a difficult situation with a friend or someone you care about expressing suicidal thoughts, do your best to get them connected. Call 911 if you need to. It is a serious emergency. And you're not going to give somebody the idea. I know that's a big misconception, that by talking about suicide or asking somebody about suicide, that they may then choose suicide that they weren't previously thinking about, and that is not the case. That is not how suicidal thoughts work. That's not how people are experiencing their depression over time. So do your best, get help for yourself, get help for your friends if they're in this situation. Also knowing that grief, especially in this time of COVID, is absolutely normal and expected, is in that we've lost a lot of what we would normally get to experience, and sadness and attachment to that is really, really normal. And so just acknowledging that if it gets to that place of not being able to function, really that's when it steps up to that needing to seek support, professional support. Thank you for your time today. We've put the survey in the chat. Please take a few minutes to do that. This is really helpful information for us. Additionally, we have we'll be sending a follow-up email in 2 weeks. If you, we may be sending you a follow-up email if you take our survey, and so just to keep an eye open for that. I do see there's a question in the chat. So yes, all of our sessions are primarily virtual. Actually, all of our counseling sessions are virtual, but we'll take attendance for the event. We are going to download the attendance and make sure that that gets to the folks requiring it, and you can have professors email us. There is confidential space available at counseling if you don't have a private space to take a counseling session, that you can be in a private space to do the virtual counseling, so that you wouldn't necessarily be in a room with another person, so you don't have to worry about masks and things like that, but that you would, but we do have confidential private space for students if they need that for sessions, so you don't have to take it from your car or with your roommate sitting next to you.
And
or
if
a
you're
family
looking,
member.
it could be hard to find a confidential space right now for virtual counseling, but if you're looking for somebody outside of NIU, a lot of mental health professionals have been doing virtual counseling, or telehealth as they call it. So you could talk to that provider.